Hello, I'm Amethyst with Sullivan Physical Therapy, and this is intended for people who are expecting or anticipating their first pelvic floor physical therapy visit. To start off with, most people might be wondering, what is pelvic floor physical therapy? But what I typically would start indicating or encouraging people to think about is what is happening with my bowel, bladder, sexual function, or pelvic pain. Your doctor may have referred you here for any of those reasons because our clinic specifically specializes in treating those things all day, every day, all of us on staff. What you may anticipate at your first visit, our front office staff probably already provided you with paperwork. If not, on paperwork, you would anticipate questions like, what symptoms are you experiencing? What are your goals of physical therapy? What medications are you taking? That gives us a better idea, and in addition to medical history, that gives us a better idea before we take you back, what things or questions we might ask so that we can make your visit a safe experience and a productive experience. Once we receive paperwork, and our front office has discussed scheduling and insurance. When you come to your first visit, usually people often ask what to wear. That kind of varies a little bit. Athletic clothes is a good option, but if you're coming from work or in a dress or business clothes, no big deal. We aren't set up like a gym, so when you enter, it's a private treatment room and there are one-on-one visits, either for 45 minutes to an hour. And I think most people are expecting a gym type setting, but what you see is what you get. And that allows options for us to work on exercises that you would typically do, that you would be able to do at home without equipment. They might include stretches, strengthening things with a TheraBand. But I think people's main question is the pelvic floor specifically, are you going to be touching, for example, around underwear line or groin? And that may be true for some people, but my first and foremost is that we're not going to do anything you're not okay with. But I do tell people I do internal, vaginal, and or rectal exams if appropriate. And we'll talk about it based on what your symptoms are, if that may be appropriate for that day. So once you come into the clinic and check in, your therapist will come get you at your designated appointment time, take you back into a private treatment room. They'll start asking questions depending on timing and or your history. They'll ask questions about, for example, your pain or your urinary leakage or constipation. They'll likely provide you with education, tips and tricks on what to try to help manage those things that you can go home and do right away. If they feel like an exam is an appropriate for them to check on that first day, they'll likely ask you to undress waist down, removing pants and underwear, but during that time, they'll step out of the room. If they do a vaginal or rectal exam, it'll be with a gloved, lubricated finger. And they'll always let you know every part of the process. If you're doing okay, if you would like them to stop, you're welcome to adjust leg positioning or pillow positioning, because we always want to make sure you feel safe and that we feel safe in the room. During that time, they'll likely ask you if you have any pain, tenderness, or discomfort, because that helps give us feedback on what the muscles are doing and how they might be contributing to your pain or other symptoms. And they may ask you to do a couple of tasks during an exam. For example, can a Kegel, or they might ask you to squeeze like you're trying not to pee or trying not to poop. They might ask you to push or bear down. They may ask you to cough. All of those gives us other clues into what's happening. If they decide, or in addition to an internal exam, they may be also pressing at your belly, pressing along inner thighs or glutes, depending on your pain. They may look or ask you to do things like squats, sitting up and standing down, or getting in and out of the bed, reaching forward, because we're looking for things that might reproduce your pain or things that might give us signs that certain muscles aren't doing what we intend or want them to do. First visits usually go by pretty quickly, and there's a lot of information thrown at you the first day, but we always try to send you home with things you can start with right away, whether that's while you're peeing or in the car, or they might ask you to start a routine or series of stretches or strengthening exercises and get you going on things you can practice at home. Or they might encourage you to say, hey, maybe we're not the right choice or place for you. You should follow up with another provider. That might include a chiropractor, acupuncturist, or massage therapist, or refer you to a mental health therapist or gastroenterologist or urologist, because we want to always work as a collective team. And it can oftentimes be helpful to find someone who has good awareness and knowledge of what other providers can and how they can best help you. But I hope that gives you a little bit of a better idea of what to anticipate on your first day, because it can seem very scary and intimidating when it takes you by surprise and you walk into a private room with someone. But really, we want to make your visit and experience as comfortable as safe as possible. So please feel free to bring up any things you're worried or concerned about with your therapist, because we want to make sure that we're treating you in the best way possible. So I hope that helps. We look forward to seeing you and catch up with you soon.